So the amyloid, for a long time, it was thought that the buildup of these amyloid plaques in the brain is causing Alzheimer's, right? Okay, there's all this amyloid for some reason, and it's kind of gunking up the works, for lack of a scientific term. It's just getting in the way. And that's kind of true. That does happen. A lot, these amyloid, they're protein fragments that build up outside the cells, and they build up and they solidify and like cross-link with each other into these infamous plaques. Except everybody's brain produces amyloid. Healthy people, everybody produces amyloid. The problem in Alzheimer's disease is that for some reason, it's not cleared away properly. It just sits there and builds up. Another thing to realize is not only does everybody produce amyloid, amyloid is not causing Alzheimer's, because when they, if they do an autopsy on somebody that either died of Alzheimer's or people that don't die of Alzheimer's, and they can dissect the brain and they look for these plaques. And plenty of people who have Alzheimer's, who die from Alzheimer's, do not have the plaques when they get autopsied. Their brain, or they have a very low level of plaque, not a level that you would expect to be causing the severity of the disease they had. And then other people who die very, very elderly, very healthy, they just sort of died of old age, they get autopsied and their brains are riddled with plaque everywhere. So you can have lots and lots of plaque and not have Alzheimer's, and you can have Alzheimer's and not have lots of plaque. So clearly this plaque is not causing the disease, or if it is, it's not by itself, it can't cause it, because you can have the disease without lots, you know what I mean? There's a new school of thought that this plaque might actually be protective to some extent. It's antimicrobial, it may have some other protective properties. And it is true though, that when it starts to build up these proteins, it forms these plaques, and those plaques do physically get in the way of these neurons talking to each other and sending, impulses back and forth. And so then the question becomes, why are they building up?
The whole, why are these amyloids forming? I think that's a good kind of setup for why you got interested in this. So maybe we can dive in deeper now about why you believe, or what the research is saying for that.
Yeah, one thing I can say is that, a couple of things that I want to say. My book came out in 2017, so it's been a few years.
Yeah.
Everything, not that I claim to be right about everything, but even just in the couple of years since then, more and more research has come out, all of which only strengthens the argument. More and more showing that chronically high blood sugar, we know type 2 diabetes is a major risk factor for Alzheimer's, but I want to emphasize, because I love the phrase type 3 diabetes, because I think it just hammers home the fact, like, oh, this might be a blood sugar problem or related in some way. But to anyone, watching or listening, if you're thinking, oh, that can't possibly be my problem or my grandmother's problem because they're not diabetic, we have to understand, and we probably talked about this in a previous show with the end your carb confusion, just because your blood sugar is normal doesn't mean you do not have massive metabolic problems, because in millions of people, your blood sugar might be normal because it's being kept in check by very high insulin. And in Alzheimer's disease, they have shown that high insulin, regardless of where your blood sugar is, high insulin is a major independent risk factor for developing Alzheimer's. And by independent, it means even regardless of your family history, regardless of your genetics, because there is like a very big genetic component to Alzheimer's, regardless of any of that, if you have chronically high insulin, you are at increased risk for Alzheimer's. So you don't have to have diabetes to be at increased risk. So the plaques, where does this fit into those amyloid plaques? One of the most surprising things that I came across when I started learning about all this is when these amyloid fragments, these proteins form, and remember, this is normal, they form in everybody's brain. What normally when things happen in the body, like things pop up, other things come along to clear them away eventually. We can't just have things lingering in the bloodstream all the time or lingering in the brain all the time. So there's an enzyme that clears away these amyloid pieces. Except this enzyme doesn't just clear away amyloid, it clears away a lot of other stuff too. One of the other things it clears away is insulin. It's literally called insulin degrading enzyme. And the analogy I use is that parents that have more than one child will always claim they don't have a favorite child, right? They love everybody equally. Enzymes in human biology or biochemistry do pick favorites. It's called affinity. They have a higher affinity for something, like they have a favorite child. The favorite child of this insulin degrading enzyme is insulin. So when your body is just awash in insulin all the time, the enzyme is too busy dealing with all the insulin, and it's going to leave everything else to build up, including the amyloid. So, and that's at least one. There might be other reasons why that stuff is building up, but that is one of them. That enzyme is just too busy dealing with the insulin.